Well, hey there, it's Liz Rohr from Real World NP. You are watching NP Practice Made Simple, the weekly videos to help save you time, frustration, and help you learn faster so you can take the best care of your patients. It is Breastfeeding Awareness Month in August 2021 at the time of this recording, and I'm talking today with a lactation consultant, Joanna Kreyling. She is also a pediatric nurse practitioner, and I brought her on the channel for an interview to ask her about what lactation consultants are, what they can help with, when you would want to consult with them or refer your patients to them, and lots of pearls and pitfalls to keep in mind when it comes to breastfeeding and supporting your patients, both the parent that is breastfeeding and the little kiddo that they are caring for. So I really hope you enjoy this interview. Lots of pearls of practice and resources and takeaways. Without further ado, I'm going to share my interview with you. All right, well, welcome. Thank you so much for being here. Can you start by introducing yourself?
Yeah. I'm Joanna Kreyling. I am a pediatric nurse practitioner and a board certified lactation consultant. I'm the director of clinical operations for Nest Collaborative. I live in Ohio and I have 4 kids.
Awesome. So let's start with what are lactation consultants and what do they do? Like
Okay.
Square one.
So that's a really good question. There are different certification levels. So an international board certified lactation consultant can see, internationally we can see clients. So it's unlike, when you're a nurse and you can only, or a doctor or whatever, and you can only practice in that one state. So to be an international board certified lactation consultant, there is quite a bit of lactation related education that you are required to complete. There's a couple different pathways to get the experience hours. So that, that can really be something that can be difficult, or it could be more easy for different people to obtain. And then it's also, where are they obtaining that experience from? Is it just hospital-based, initial latching on, or is it, all the way through weaning, maybe seeing children 2 years old, or so experience is wide. And basically what lactation consultants are trained to do is to assist in whatever goals that the family has, whether that is increasing milk supply, or not nursing, or pumping and nursing, exclusively pumping. It's whatever that particular family has a desire to do.
Cool. And what I guess maybe segue into this question. What had you became a nurse practitioner? You were a nurse practitioner first, and then you became a lactation consultant. What had you become a lactation consultant specifically, like get that additional training and certification?
Well, in my nurse practitioner program, we did have I remember learning a bit about breastfeeding. And I think, some programs don't have it at all, and some programs do, to the extent of what they're covering. I'm not sure, it varies. So by the time that I actually had my first child, I realized that, I didn't know enough to help my clients, because I certainly needed help. And I did the triple feeding for 2 months until I decided enough was enough with my first one, because nobody gave me a plan. No one said, we want you to do this, and, you should see results by this. And no one helped me reevaluate if things were working or not working. I certainly didn't know that a lactation consultant, I guess, I don't know, I thought that they were for that initial postpartum period, or I don't know that I considered at all reaching out when the baby was 2 months old to see if there was anything else I could do. I think I just kind of made the decision on my own because I felt overwhelmed and knew I couldn't continue doing that. So, it's definitely something that was challenging. And I think my second child is when that went better. And so, but in that process is when I really got my certification hours and all of those things and became certified. So yeah, it was between kid 2 and 3. I think about it for a minute. But yeah, I mean, just when clients in the office, in the pediatrician's office would have breastfeeding concerns, we didn't really, I didn't know well enough what a good feed looks like and how to assess latch. I mean, and I think a lot of my male cohorts would call me in to do the breastfeeding stuff. And it was just like, well, just because I'm a woman or, have had children or whatever doesn't make me a breastfeeding expert. So it was really something that I wanted to be able to help my clients because they were asking and I was like, I don't know. Totally. And just really wanted to give them more information and better information than I received.
Definitely. And on that note, kind of tying that together, like, I'm trying to take the perspective of, so for me, just like anecdotally, I shared this with you a bit before that I have a child and I breastfed and I had a really challenging experience. And I feel like I learned so much through that challenging experience. But I'm trying to take the frame of reference of like nurse practitioner education alone without having any experience with breastfeeding or parenting. Like, if we can like bring it back to that, like if somebody is like not familiar at all with lactation consulting, like if they're an NP student or a new grad NP, when would they want to contact a lactation consultant or think about referring their patients to one in your kind of experience and perspective?
I think what I would really encourage people to do would be to find lactation consultants in their area or to identify those that they really trust, and realize that you don't need to be a breastfeeding specialist. Firstly, if you're we know this, that, if you step back and think about it, if you are doing, primary care, for example, you have to know a lot about a lot of things. You have to know a whole bunch.
Yeah.
So, it's, you could give the example if someone's child needed help, because they're having difficulty walking, we wouldn't say, okay, as the pediatrician, I want you to put on braces and I want you to have your child walk from this side of the room to this side of the room 5 times daily and come back in a week. No, we refer out, right? We refer out to physical or occupational therapy. Right. We refer to a specialist, someone who's really good at recognizing normal, not normal. Yeah. What can that particular family, what will work for that particular family, that particular child, to meet whatever their goals are. So, just that, like I said, you don't have to be an expert. If someone has questions, if they are unclear, if they just want to learn more, if you have questions, give them a call. Just give yourself that permission to, if you're not sure, have that really good resource available to you, and use it. And I think that that's really the best advice is, they're the specialists. They should be able to work specifically and be in unison. As you know, that's with Nest Collaborative. We're really proud of our continuity. So we work with pediatricians, and we work with obstetricians, and we work with, all of these different healthcare providers, because we want to all be on the same page with these clients. And I think that recognizing that, and then also recognizing it's okay to be preventative. One of the things that we're really passionate at Nest Collaborative is preventative care. So what are the time periods in a journey that are potential pitfalls? For example, my golden example is always around 6 weeks, your breasts may become a bit softer because your body has gotten, in tune with your baby. So your supply meets their demand. A lot of women, though, they don't realize this is the reason. So they think, oh my gosh, my breasts are softer. My milk supply is going away. I need to supplement. Well, if they start supplementing, it's going to throw off the breastfeeding and the actual milk quantity that she does have. And so let's talk to clients. Let's talk to these families and say, be preventative. Let's see them at 3 to 5 days. Let's see them at 2 weeks. Let's see them at, whether they're before they go back to work, before they start solids, before we don't have to be problem-based care.
Yeah, that's one of the things I was going to say is like, I think that if you have no experience, like I was a nurse practitioner when I had my daughter, and like in my mind, only sought lactation consultant care when I had a problem. And I think that I knew as a patient and as a provider that I was like, I'm really worried about breastfeeding. I should probably have this conversation. Like, what do I do to prepare? And I was a little bit like not, listened to in a way where it was kind of like, oh, it'll be fine. I'll show you how to do it. It'll be fine. But it's like you said, like, it doesn't have to be problem-based. It can be like, let's think about this before delivery. Let's think about it right after delivery. Let's think about it at those pitfall potential moments.
And especially if you have those clients, that things don't go well the first time, or they have, maybe they have, mom has a health condition and she's concerned about the medications or health, something associated with her body. Or maybe there's a diagnosis with the child already, like the child is going to have a cleft palate, or so these are all reasons why it's really good to meet with a prenatal consultation. I love that we do ours one-on-one, because we can ask the clients, okay, well, what have you heard? What are you worried about? And usually it's low milk supply and pain. And so,
I was going to say, especially for first-time mothers, but even like first-time parents or multiple-time parents, like there's so much to think about at every interval. Like, you as a parent who has a child in front of them for the first time might not have the brain space or sleep capacity to think about learning a new skill. Right. And so like, how can we make this as easy as possible for our patients to like think about it beforehand when they are relatively well rested, right before delivery, and then after, and that whole piece.
Yeah. And like you said, just normalizing, like, let's see them, the AAP recommends that there's a breastfeeding assessment in the office, days 3 to 5. And I'm thinking, well, how many healthcare providers feel comfortable doing that? How many healthcare providers can do that and really know if a latch looks good or not, or, how to help with that. So, that's a great reason to just have them check in, and, they think everything is going great. They just want to make sure, and, we can a lot of times just reinforce what they're already doing and give them that support, because we have initiation in the United States. We do not have duration of
You mean
breastfeeding.
of breastfeeding? Yeah, no, for sure. For sure. And one thing I was going to ask you about, was, well, I guess one point and a question. So one thing this is reminding me of is that I did an interview with a physical therapist, and I think in primary care and maybe in, pediatric practice as well, I think that sometimes we misunderstand specialties, whether it's a provider specialty or if it's a like associate medical field, like physical therapy, occupational therapy, because we don't understand what they do. I think it's easy to dismiss, like, whether or not they need that, right? So I think a lot of, like you and I were talking about before, about sometimes providers feel like they feel comfortable enough with breastfeeding that it's like, oh, that's enough, but also just like not underestimating, just because we don't fully understand what it is, what it means and what it's like to be a lactation consultant doesn't mean that there isn't like this whole range of services that can help.
Right.
Because I think that's one thing that I really aim to help us do as like a profession is like connect with our other multidisciplinary professions, right? And so even if you don't know what a lactation consultant does, just like trusting that there's like a whole training process, there's like a whole knowledge base, there's like all these other things that we can do. So like, just don't underestimate that. So that was like one point I wanted to connect. But then the other question I had for you, I am not savvy about this at this moment, but what is your experience of insurance coverage with lactation consulting? If you can speak to that, a lot of the people in the audience of Real World NP struggle with patients having limited access to resources.
Right. So that is a really big one. And that's something that Nest Collaborative is very, feels very strongly about. Our founder, Amanda, she really works to insurance companies that should be following the Affordable Care Act and covering the minimum of 6 visits. We will be, working doggedly to get those visits covered, because they are, part of that, and they have, they should be covered. So, that is huge. And a lot of lactation consultants, the way that they work is they'll give the clients a super bill and they'll encourage them to turn it into their insurance.
Yeah.
Well,
that's not possible for a lot of.
It may not be possible, or, what happens if the insurance company comes back and says, we're not going to cover this? A family member, this family that they have a new baby, they're getting all these bills in. Do they know how to, I don't know that as a first-time parent that I would have known, like, well, I can fight this. Like, I don't know.
Yeah.
So, I think that, figuring out the local resources, like, whether it's, encouraging them to go to La Leche League, or to find in their area lactation consultants that do take the different types of insurance, and, keeping a list of it, or, you can check with Nest Collaborative, but really looking to see what you can do to support, because it's just so important. There's a point in breastfeeding where it's like, you kind of just have to trust and let it go, because it's not precise.
Yeah.
So that is a lot of what lactation consultants do, actually, is a lot of counseling and a lot of education, because they're, especially lately with COVID and all of this, these families are really on edge. So having that lactation consultant there to say, your positioning looks wonderful.
That feels so good.
You're doing, your baby is having 6 to 8 wet diapers and 2 to 3 bowel movements a day, and look at their little double chin. Like, oh my goodness, your baby is beautiful and you're doing such a good job. And I know this is a really hard time period. So let's talk about some ways that you can get some more rest. So there's a lot, even with the telehealth, there's a lot of questions in terms of, well, how can you do breastfeeding over telehealth? You can't do a way nurse way. You can't do this. You can't do that. And that is true. We can't do a way nurse way, but we can help with positioning, and we can, we can see, I mean, I've definitely, we can have consultations where at the beginning, the baby is like this. And by the end of the feed, they're like loose, like spaghetti. I don't need a way nurse way to know that baby is completely filled to the brim and happy, so.
Yeah. And just to clarify for people who aren't familiar with that, is like one of the things lactation consultants can do is weigh the baby on a scale, nurse them, and then weigh them again to see how many ounces they've consumed. Mm-hmm. Is that correct?
Yeah. Yeah. And, that in itself is a bit problematic because babies feed for a variety of reasons. I mean, if you've ever breastfed, you know that, and, the dog barks and wakes the baby up and they need to nurse for like 2 minutes just to go back to sleep. Right. Or, they're in a strange area, they're not in their home environment, so they nurse differently, or, their schedule gets off, or, all of these different factors. So we do a lot of just teaching, these are hunger cues. Yeah. This is the time to feed your baby. Yeah. This is normal output. Yeah. This is normal. This is not normal. Yeah. Giving them those tools, giving them that confidence to know that they're doing a great job. And, just so babies start to cry and do some cluster feeding in the evenings. That doesn't mean that your supply is low. Let's talk about that, giving them that education, that reassurance, guidance on, the baby's positioning, how mom can be more comfortable when she's nursing. Mm-hmm. What can the support people, I just have the one nice thing about COVID is like all of the support people that have been on the visits and having them be part of it. Yeah, hey, cool. Jeff, can you get a pillow and put it under, the mom, under the baby? Do you see how, the baby's face is now facing mom's body? We eat facing the dinner table. So babies do too. Make sure that the baby is, so involving these other people has been just so wonderful because they're there. We're not there 24/7.
Totally.
And maybe the support people are more rested and can remember things later.
It's true. It's true. And like, what a beautiful thing, especially for nurse practitioners watching or students who are watching that have no experience with lactation, anything. Like just imagining what a beautiful extra layer of support. We're always looking for more support and education for our patients in our limited time windows. Like what a beautiful thing to have a theoretically covered by insurance service where somebody is like giving such positive energy and education and support to meet their health goals, right? And the child's health goals as well. So,
yeah. And, those are all things, you're right, that we will talk to them about as well. The positive health benefits for the mom, for the baby. We also do like a mental health assessment. So we're, checking in on that and, really talking through the whole, and that's one of the things I love about, or I really want reasons why I wanted to be a nurse practitioner is because I really feel like nurse practitioners are so good at that education piece. And we see that client, the whole picture of that client, their whole family unit and all of the different parts of that client. And it's just been a joy.
Definitely. So I think a wrap up question would be, I wanted to wrap up on some of the takeaway points. So I think a couple of takeaways that I would share, and you can jump in with takeaways, but I feel like the main takeaways that I would love to impart for people is like taking just acknowledging lactation consultants exist. Mm-hmm. Theoretically, it's covered by insurance. And that also it can be from a preventative perspective and not just a problem-based perspective where you're jumping in when somebody's having pain or the baby's losing too much weight or something like that. And then, the finding a lactation consultant group, especially for newer grads, it's really hard to get the lay of the land. But like, if you can find a lactation consultant you trust, that your clinic already works with or trusts, like connecting with them, getting to know them, and collaborating with them. I mean, it sounds like, and hopefully collaborating with a lactation consultant that understands the clientele you work with, and with regards to insurance coverage, if you have challenging insurance coverage situations, that they understand your clients. But yeah, any takeaways you want to share in addition, or like other resources that people can look at to find?
Yeah, I mean, I would just, you did a really good job of summing it up. I would just say, yeah, if you have questions or concerns, then you check in with a lactation consultant, and you could follow a lactation consultant to learn more, or it's just it's really great preventatively, and also if there is a problem, and just that we are here to help. And yeah, that's it. I mean, really, that's about it. And
awesome. Well, thank you so much. Where can people find more information from you? You work with the company Nest Collaborative, correct?
Yeah. So we're at www. or HTTPS or whatever it is these days. We're at nestcollaborative.com, and you can see the insurances there. We frequently have people who will call or message about insurance coverage, but we do have it set up so that we would notify if insurance was not going to cover it, because that would that's just what the fair thing is to do, to warn people. But yeah, we're very much happy to help and to collaborate, and to be part of care teams, for helping these clients be successful in the long term to meet whatever their goals are.
Awesome. Well, thank you so much. I appreciate it.
All right, no problem.
So that's our episode for today. If you haven't grabbed the ultimate resource guide for the new NP, head over to realworldnp.com/guide. You'll get these videos sent straight to your inbox every week with notes from me, patient stories, and bonuses I really just don't share anywhere else. Thank you so very much for watching. Hang in there, and I'll see you soon.